My name is Sydney McGuire, and I'm a PhD candidate at the University of Minnesota in the School of Public Health. And next, I will introduce our panelists for today. On our panel today, we have Ms. Michelle Futrell, and she's a licensed and registered dietitian. She received both her master's and bachelor's degree in food science and nutrition from the City University of New York. For more than 40 years, Michelle has ardently advocated for nutrition and health-related issues that affect the well-being of all Americans. Michelle is the founder and CEO of Consultant Nutritionist LLC. Their mission is to reverse the proliferation of food-related health disparities and champion healthy lifestyle choices. As the lead consultant for the Association for State Public Health Nutritionists Policy Committee, Michelle works closely with state public health nutritionists from all over the country to support equitable legislation, policies, systems, and quality of life outcomes. Michelle is also a member of the Farmer Food Share Board of Directors, a nonprofit organization reshaping North Carolina's disconnected food system by removing barriers to growing and accessing local food. So please welcome Michelle Futrell. Next, we have with us today, Tiffani Grant. She's a registered dietitian and currently serves as the director of the Bureau of Community and School Health at the Mississippi State Department of Health. The responsibility of this policy level position includes developing program strategies and providing professional development and technical assistance to community-based organizations, childcare centers, hospitals, work sites, and school districts on effective community and school health programs. Ms. Grant current areas of focus are physical activity, nutrition policies in early care and education, food insecurity, and social connectedness during COVID-19 in communities. She received her Bachelor of Science in Nutrition and Dietetics and Master's of Science in Nutrition and Food Systems from the University of Southern Mississippi. Ms. Grant is currently the past president for the Association of State and Public Health Nutritionists. So please welcome Tiffani Grant. And finally joining us, we have Dr. Alisha Davis. Alisha's professional background is in healthcare management and community health education. She has worked at both Spectrum Health and Priority Health and has been in healthcare for over a decade. Alisha has a considerable amount of experience in healthcare diversity, health literacy, population health, and disease management, and healthcare disparities. Along with her healthcare background, Alisha has worked with the Grand Rapids Public School System's after-school programming and service learning projects in collaboration with various community organizations. She has also worked with the transitional housing programs for homeless individuals and families through Dwelling Place Incorporated. Alisha earned her bachelor's degree in community health education and a master's degree in family and consumer sciences and a doctorate in educational leadership, all from Western Michigan University. She has taught several of the courses in allied health and regularly teaches legal and ethical issues for health professionals. Alisha's research interests center on diversity in healthcare, healthcare disparities, health professions pipeline programs, microaggressions, global health, and recruitment and retention of underrepresented minority students. So please welcome Dr. Alisha Davis. And these are our panelists. I forgot to go to the slide. So next we'll just do some general housekeeping. So everyone has been muted upon entry, and please try to remain muted throughout the duration of the webinar. To ask a question, please utilize the chat box or the question and answer feature, indicating which panelist you are directing your question to. Please follow APHA Food and Nutrition section on Twitter at APHA Food, and also follow ASPHN on Twitter at ASPHN1. And use the hashtag APHNFN Mentoring to share your thoughts on this webinar today. So without further ado, we're actually going to get started with the panel discussion. And so we're going to be talking about, we have two main topics for our discussion today, and that includes translating diversity to equity and mentoring for equity. And so I'm actually going to stop sharing my screen right now so we can see each other's videos and have this discussion with the panelists. Okay, so first I'm just going to begin with our first question to all the panelists, whoever wants to speak first. The first question is, do you think diversity in the workplace translates to equitable practices in nutrition? So for example, does a racially diverse workforce promote allocating more resources to people of color with low access to healthy food? Michelle, I see you unmuted. Thank you, Michelle.
Oh, yeah, I am unmuted. I mute some occasionally just so that you don't get the background noise of my terrifying dogs. So, but no, I don't think that it automatically ensures resources being allocated. I think it can be if strategically set up to be, but I've known many situations in organizations where they have a diverse workforce, but it's not an inclusive workforce. So for instance, you'll see there are people of color, but they're not in managerial positions. They're not in leadership positions. They're not the CEO. And so therefore, those are the areas where resources are allocated. And so we don't necessarily see that happening just because there is a diverse workforce. But it can happen if it is strategically set up to be that way.
And I'll just piggyback on what Michelle was saying, that basically just because you have a diverse workforce and working together doesn't mean that they have power to be able to make those decisions. You still have to go through different layers, and although you may advocate for something, but the people in power may not allow that to occur.
I think you have to have the right people in power too, that have the right mindset in order to help make those changes. And I think oftentimes, especially when we're dealing with our communities of color, we typically don't have the right people in place in order to make the right decisions. And so, you know, looking at what our leadership looks like moving forward, I think will be an essential part of making things more equitable.
I also think that the organization has to have a certain established culture in order to implement these things. You might have the people in place, but if the culture of the organization doesn't support it, it's not going to happen.
Thank you. Those are some very good comments. So I heard you saying that not only do we need diversity, but we need diverse leadership, and that diverse leadership, all of those diverse people that our companies may be bringing in, they need to have the power to enact change. So what are some of the ways that you think that these systems can be changed? How can we work together to gain some of this power that you discussed to actually make changes to established cultures so that people can feel more, so the environments can be more inclusive?
Well, I think like I mentioned before, it needs to start at the top. Mm-hmm. If your leadership is not on board with what needs to happen, then it's going to be a serious struggle. So getting a diverse leadership would be helpful. Actually having it stated in the organization's philosophy, so that it can always be referred back to, that this is our goal, this is our mission. It has to be written so that people know that it is part of the structure and then acted upon. Words without action mean nothing.
And I hate to say this word, but creating that culture. So just like Michelle said, the top down, but when we think about, who else is empowered to make some of those decisions, and what are some of the barriers that we may have that we can't provide funding to those organizations? Are there all these barriers that we need to have X, Y, and Z, but how come those communities of color may not have all those things, and so they're not able to even get the funding? So I think even looking at some of the barriers that are in place to support those communities also need to be considered. So we can't just say we create a culture, but of diversity and equity and inclusion, but we don't actually have things in power to support that.
And sometimes those barriers are outside of our institutions, right? So, when you're looking at funding, where's the funding coming from, and what barriers are in place at that level that may be creating this, this inequality within those environments?
I also think partnering and collaborating can push the marker forward. So it's difficult to do it alone, even for one agency to do it alone. So for partnership within the agency and interagency collaborations would be helpful.
Thank you. So when you think about the full range of gender, racial, and ability diversity, how have you encountered these different forms of diversity in your work? And how do you find engaging with diverse peers useful in the work that you do?
Well, I must confess that in the world of nutrition, finding diversity is a challenge. Even in public health itself, I know that when I worked with the State Division of Public Health, many of the meetings I attended, I was very often the only person of color there. And may have been, in some other instances, the only woman there. So we still have a long way to go. So I bring up nutrition because that's the field that I'm in, but I also know in healthcare in general, diversity at the top level or at the level where decisions are made just doesn't exist inclusively or equitably yet. We're getting there, but then, change takes time. And the fact that we're even talking about it at the level we're talking about it these days is a big step forward.
Thank you, Michelle. And so I think we started kind of talking about this. What kind of opportunities do you see for enacting more equity in your work and bringing more access to opportunities for people from different gender, racial, and ability groups? Like, what are some of the barriers that you think that need to be broken down beyond funding?
We have to build trust with the communities we're trying to serve. I think sometimes even coming from an agency perspective, there's so much distrust in that. So working with partners that can help bridge that gap and open that communication. But I think building trust, building those relationships, and I think listening more than talking is going to be key in developing that relationship, and people recognizing that they need to be heard, and that they're and what they're saying, that you're really seriously engaged in that, and are going to work with partners to see how can you support that.
And looking at what the needs are, and piggybacking off what Tiffani said, building those relationships are key, but we can't assume we know what it is that those communities need. We, based on literature, can come up with a good idea of, but it may not actually be what that particular community needs at that time. Maybe they have other areas that we have to focus on first in order to be able to get to that next level. And so looking at what those needs are, tapping into key stakeholders that are within those communities in order to truly be able to service the community in the right way.
And I totally agree, Alisha. I remember an organization I used to work for back in the day. I've been in this field for close to 50 years. So I remember working with an organization that was doing HIV/AIDS prevention. And we did our research. We were going to do a local outreach program. And we did our research. We had everything all written up. And then we said, well, maybe we should go and talk to the practitioners who work with this population. And they looked at what we had to say and they said, oh, wait a minute, you're missing this point and you're missing that point. And then, so we went back and revised. And we said, well, maybe we should go talk to the people who are actually going to be participating in the program. And they looked at what we had to say and they said, wait a minute, we don't want to necessarily self-disclose. We don't know, we don't have childcare, we don't have this. So it really does take listening at each level in order to come up with a viable program. And even that is not absolute. You still have to routinely evaluate it to make sure that it's achieving what it is you set out to as a goal.
Thank you, Michelle. So I heard you all saying that even if you have diverse people in the public health nutrition workforce, it's really important that we continue to build trust with the communities that we're working with, because you may have a diverse group of people working on this, but you still may not know what is needed in the community. And so kind of along those lines, what else what other things do you continually work on to best serve people who are different from you?
Well, I work on my patience. And because I'm always ready to jump into things, but I have to stop, look, and listen before I move forward, because I may think I have a pretty good view of the situation, but there's so many varieties. I mean, I'm an African-American woman, but I was born and raised in the North, and my view might be quite different from the African-American woman who was born and raised in the South. And then we might have different views altogether of African women who are born and raised in, let's say, the Caribbean or South America, or even in Africa itself. So listening and patience and active listening and paying attention to what's going around you makes a really big difference.
And I think just realizing we're not a monolith. So as Michelle said, I mean, I'm an African-American woman who's been raised in the South, but, you know, I can't speak for all African-American women in the South. And also I think flexibility, if we haven't learned anything through this last year and a half, is that we have to be flexible. You know, we need X, Y, and Z done for that grant, but that may not be how it works for the community we're trying to work with. And so we have to be open to change. And you know, because the overall goal is, if we're remembering what our goal is, then we have to be flexible to support the needs of that community. Mm-hmm.
Those are good points. And I really agree that we're not a monolith, and that we have these kind of defined identity groups that we talk about in public health. But it's also important to remember the diversity of thought, of background within these general groups that we discuss. So now I'm actually going to transition to the second topic today, which is mentoring for equity. So I'm going to ask you some specific questions about mentoring. And then after this, we'll talk about the mentoring programs that are being offered from APHA and ASPHN. So what types of training or experiences do mentors need to have to model the principles of diversity, equity, inclusion, and belonging to be an effective mentor? So how can you be an effective mentor and embody these principles of diversity, equity, inclusion?
So I'll just say being self-aware of your own even implicit biases. You know, recognizing that you too may have your own things. So, you know, just being self-aware, and just continuously then saying, okay, I need to continuously learn. I need to recognize, you know, my stuff. And then so that I can be able to be open. Because I think we all have our own biases.
I think being willing to share the power is important. In my mind, when I think of a mentor, I think of someone who's experienced and knowledgeable, who then takes on the support of someone who's less experienced and less knowledgeable, but it's much, much more than that. And there can be a give and take in terms of that power dynamics, where the mentor is sharing some power with the mentee, and the mentee has stuff to share too. So being willing as a mentor to share the power, to recognize that there are things that you can benefit from the mentee, just like the mentee can benefit from you. I have learned some really important lessons working with interns and mentees. In fact, it was my interns that taught me how to turn on the computer. So there are benefits to having both ways, having benefits as a mentor, sharing the power.
And I think just simply going back to the trust and mutual respect, you know, trying to build a trusting relationship, you know, which brings in many different aspects, like making sure that things are confidential, making sure that you're, you know, that it's not all about what you want the mentee to get, it's what does the mentee want to gain from your relationship as well. So what goals do they want to have in that relationship? And then, you know, like I said, that mutual respect piece, you know, while it may appear like you're in a position that is, you know, kind of more of a hierarchical position, it's not really the case. You know, really, yes, I have some things, or we have some things that we want to provide to you, but, you know, I'm not above you or below you. You know, we're at the same level. And so when I work with mentees, I always want them to feel like we're at the same level. Yes, I do have this position and I'm working with you through this position, but that's not who I am in this relationship. I'm here to help you get to where you want to be in your next, you know, now, and what you want to be, where you want to be in the future.
Mm-hmm. I think encouraging and being supportive is also very important, because as a mentee, I have been in that position too, where you're not totally 100% confident about your position. So having a mentor who's supportive and encouraging is another skill a mentor must have.
Thank you. So along those lines, I was thinking, what are some of the things that you have done in your career working with mentees to help build their confidence, and specifically for students who are from historically underrepresented backgrounds?
Mm. I think trying to get a sense of the challenges that your mentee is facing would be helpful. I mean, not every mentor, not every intern comes with this equal amount of education or resources. So that is important, to get a sense of what's going on with the particular person you are working with, because everybody is different. And then as a mentor, seeing how best to help fill in the gaps and model and lift and support.
Also add, that's another one of my words, being flexible. We're in different times, and these current mentees are dealing with things that I haven't experienced, but they're experiencing now. So you have to be flexible, as Michelle said, encouraging, supportive. You know, again, you may think this is supposed to be due today and that they should have the skill set to be able to do it, but you might have to take a little bit more time and talk through it, encourage them, say, you know what, because you don't know what other barriers and that they're facing. And I think sometimes when you're with that individual, you're in work mode, but you can't be in work mode, especially now. I think so. Patience, flexibility, and therefore, I think if you can build that relationship and build that trust, then that mentee will be open to sharing, because you may automatically assume, well, they're not interested, but you don't know what other barriers that individual is facing. And you need to be open to that.
You know, Sydney, I was looking at some information about mentoring, getting ready for our conversation. What impressed me was the number of studies that highlight how important the mentoring of others is to promotion, reaching attainable salaries, diversity within an organization, and it was one other thing, but it's very, very important in terms of what the organization can get, what the mentor can get, and what the mentee can get.
I echo what Michelle is saying. I've been looking into some programming that we're looking to begin at the university, and that's a key piece when you're looking at women who are of color that are in leadership roles. How did they get there? And oftentimes, you know, it takes a long time for them to get there. So how do we encourage them to move in a intentional direction? And so having a mentor, being able to shadow that mentor, and figure out what is your next career path. You know, what skills do you need to learn now in order to move into that next level? You know, working on things like communication, and, you know, being able to be your authentic self within whatever role you're in. And I think oftentimes it's a hat that that we sometimes compromise being a woman of color in a leadership role. And I don't think that we should have to. We should be able to be our authentic selves throughout our roles. And so it's a challenge. It's a challenge to be a woman in a leadership role that is a person of color. And so having someone that can help guide you that way in a mentorship role is a key piece in order to help you get to your next level.
Mm-hmm. And also help organizations retain individuals of color in the organization.
Thank you, Michelle and Alisha. That point that you made about being your authentic self really hit home for me. As a student, I did struggle with coming to academia and being my authentic self. Now, as a fifth-year student, I've definitely grown a lot, and through good mentorship, I've figured out that I can be my authentic self and bring my whole self to the academy. And so going along with that, what advice do you have for students or early career professionals who have historically been underrepresented in public health and nutrition? What advice do you have for them in looking for a mentor and trying to figure out what they should do to take the next steps in their career so that they're intentional?
I think one thing is you need to have different types of mentors for different areas or aspects within your career path. Have another person of color in a leadership role if that's the way you want to go, so that they can provide you information to be another person of color in a role similar to that. But you also may need someone that is part of the majority group to help you navigate the space that you're in at that time, because the rules aren't always set up. Well, they're not. We're not going to say always. They're not set up the same for a majority person versus people of color within the spaces that we frequent. So I think you need different ones for different aspects within your career. As a student, finding someone that can help you, focus on what is your career path going to be moving forward. You have to be intentional with your thought and your direction. And so finding someone that maybe is in a role similar to where you want to be or where you think you want to be, and then have them, provide you with mentoring and go towards that particular direction.
I think a lot of students don't necessarily think about finding a mentor. I think they're focused on their grades and focused to get from point A to point B. So I would suggest that they actively begin to look for mentors. Think about what they want and see who would be most likely to help them get there. You have to act, and you could have peer mentors too. You can have your peers form a group and be mentors to each other. So that's another way of developing a mentorship collaboration from the student's point of view.
I also think just being open to different opportunities. Let's say you're interested in food insecurity or just food for itself, but also realizing that there's so many levels of that. So even if you're not in that particular, working directly with that you may indirectly work with food insecurity through other work that you may have the opportunity to participate in. So not like boxing yourself into one specific thing, like I just only want to do this, but there may be opportunities to still use, because what we do, I think every day, I think all of us, we multitask, we're in multiple groups, and you kind of need to be able to, I'm a dietitian here in this work, but I also realizing the skill sets that I've learned from going through school to be in a leadership role, to be in, to do budgets and to do management and do all these things. And so I think just even being open to other, to opportunities and not box yourself into, one thing.
I agree, Tiffany. I've known many students who would come through and say, I'm going to be this and they focus on just one thing, like I'm going to be a clinical dietitian, without necessarily thinking about what the options are. I always say, the best way to make the Lord laugh is to tell him you have a plan. You have to be flexible enough to see when opportunities come your way to take advantage of them.
Yes, thank you. I think you all made some really good points and things that I know for me personally have been very helpful. Having different types of mentors and also having peer mentors. I have some mentors who are just a couple years older than me, so they're going through things right before I do. And then also being open to engaging in different types of projects and also engaging with people from different disciplines and just kind of learning things from all over academia. So thank you very much. And so finally, this is going to be my last question on this topic, and then we'll get into some question and answers from people in the audience if they have any questions. So be thinking of your questions and put them in the question and answer box if you have any. So finally, what can mentors do to be successful in supporting students from diverse identities? So we've gone through a couple different things like being flexible and giving encouragement and support. And I just want to know, do you have any more specific or tangible things that you've done in your career that have helped you to be a good mentor?
Well, I know that to be consistent, I have selected certain things I'm looking for in terms of how I find out more about my mentee. Certain questions I'll ask all the time, open-ended questions that will help me get a sense of who I'm working with and what their needs are. I make sure that I cover some basics so that I can start from there to learn other things. And then the next thing I try to do is to be as open as I possibly can and be as receptive as I possibly can, because I don't want to be the one that shuts down a positive opportunity. I want to be the one that adds fuel to that positive opportunity. So that is what I see myself as a mentor doing whenever I run into any particular mentee. And I say it that way because, you know, different folks need different things, but I want to make sure I get a sense of what those different things are and how I can best help them reach that.
And I'll just piggyback. I mean, everything has to be individualized. I've had, seen mentees that just will go at it and go forth and do. And I've seen, had mentees that I have to spend a little bit more time with. And so again, it goes back to Michelle, like getting to know them, asking those opening questions, and then it's individualized. I've just experienced where, someone I need to meet with every week and we need to have that conversation every week. And then you have some people that, again, they will go forth and do. So I think, again, and then just, realizing I don't know everything. And you know what, we'll figure it out together and let you know that you don't have to know everything. There's that you can research, we will learn together as well. I think that makes you more human, because I think they get the thought that you're here, you're working in your field and you know it all. No, I don't. But you know what, we'll figure it out.
And I always go back to, after I get to know them, we've had some of those initial conversations. I always go back to, what is it that you want to gain from this relationship? What do you want to get out of this relationship? Because I can make all these assumptions and try to give you, all these pieces of sage advice. I'm completely off the mark. So, what is it that you want to gain from this relationship? And maybe they don't know yet. And that's okay too to say. But if there is something specific that they want to gain from the relationship, what is that? Because I want to make sure that that's an aspect that we focus on in our interactions.
I also think that learning how people communicate, because not everybody communicates the same way, is very, very important. So some people you can be really direct with and say, this is that, this is the way it goes. Some other people need a little more detail, a little more background and support. And then not just verbal communication, but nonverbal communication is very important. I remember one instructor was very upset with a mentee that she had, and she complained that he never looked her in the eyes. He was shady because he never looked her in the eyes. Well, he came from a culture that didn't encourage looking in the eyes of someone who was your superior. So he was giving her proper respect, but she interpreted it as disrespect. So learning how people communicate, both verbally and non-verbally, and making sure that the messages are understood. So I could say one thing, but how you understand it is another. I need to make sure that you are understanding the message in the manner in which I intended it to, and then in reverse, that I'm hearing the message that they're trying to send me in the manner that they intended to. So communication is key.
Thank you, Michelle. And I really like what you said earlier too about adding fuel. That sounds really confidence building for your mentees. And I think that that's something that's been very helpful to me as a student. So that's all of the set questions that I have for us to talk about today. And I really want to thank all of our panelists today, Alisha Davis, Michelle Futrell, and Tiffani Grant. And just for a second, I'm going to share my screen again to talk about the internship and mentorship opportunities that we have available. So ASPHN has a program on health. It's the Health Equity Internship Program for Public Health Practice. And this program was created to support the diversification of the public health and health-related workforce. The public health nutrition workforce, like many areas of health, needs assistance with diversification and the recruitment of a new generation of nutrition professionals. This 12-week paid internship was developed to support those efforts through complete health equity projects ranging from disease prevention to nutrition to policy planning. And so ASPHN has spots open in their spring 2022 cohort, and the application deadline is October 30th, and you'll be notified by December 15th. And there will also be a cohort in the fall, and the application deadline for that is June 30th. And you can go to this link for more, and I'll try to put the link in the chat in just a couple minutes. And APHA, the APHA Food and Nutrition section, is also offering a mentoring program. This is a new program, and we'll be putting out more information on this program to come. The call for applications will be released on January 2nd, and we'll be accepting applications until February 2nd. And we'll notify people of their selections on April 1st. And the program will run from April through December, and we'll be matching the mentors and mentees together based upon the form that you fill out. And we'll be providing monthly conversation prompts, things that mentors and mentees can discuss. We'll also provide a half-day summer professional development session, and there will be a meetup at the APHA annual meeting. And so if you want more information on that, you can email us, and I'll put this information in the chat. And we'll also be sending out more information on this program to come. Okay, so now it's time for question and answers. Do we have any questions from the audience?
There was a question that was entered into the chat, and I'll go ahead and read that for y'all. I currently serve as the nutrition section chair for the Georgia Public Health Association, as well as the diversity liaison for the Georgia Academy and for the weight management dietetic practice group. We've offered member scholarships and mentorships, yet we have very few applicants. What are you all doing, and what do you recommend to connect with other dietitians and nutrition professionals to promote diversity, equity, inclusion, and access? I'm burning it at both ends with very little participation. So we have made opportunities available, but people are not coming on board.
Thank you for that question. Do we have any of the panelists who are willing to respond to that?
Well, I mean, every situation is different, but so it'd be interesting to know how the outreach is taking place. There was a study done not too long ago that said there was a significant increase in the number of African Americans students entering into nutrition programs at the undergraduate level. But when it came time to apply for the internship, there was a significant decrease. And so looking at what was going on there would be important. I mean, I've worked with the internship programs at NYU for a while, and I know how competitive it is and what weight is given to the grades you receive in science and math. And many of the BIPOC communities are low-income communities, poor education communities, and don't necessarily get the support in those areas of science and math in order to compete at that level. So we might have to dig deeper in terms of our outreach and start supporting high schoolers in science and math, and then nurturing them through the undergrad programs, and so that they're ready to compete at the internship level.
Thank you, Michelle. And one of the things I was thinking about in regards to how you can maybe get more people to, how you can get the word out about these opportunities more. Maybe, I don't know if you've done this, but maybe you could contact Black graduate student unions at different schools throughout Georgia, or undergraduate student unions. I'm just thinking about ways you can connect with people whose students may already trust on campus, or organizations that they already may be interacting with, and that may be able to help you get this information out to recruit more people. I see. So we have a follow-up. She said that, this participant said that they use social media platforms, sent information to educators, and sent information to preceptors. And I'd be happy if you have like a tweet or social media that you've already sent out. I'd be happy to retweet whatever information that you've sent out, Cicely Thomas.
Mm-hmm. I wonder, is this an internship, a dietetic internship program that we're talking about?
I think this question that what we're talking about now, it's the nutrition section for the Georgia Public Health Association, and it says that they've been offering membership scholarships and mentorship programs.
I see. Mm-hmm.
Mm-hmm. And Steve just commented that ASPHN partners with minority serving institutions as part of their outreach to reach out to people. And we actually do have another question in the question and answer section. And this comes from Karen Probert. Sorry if I mispronounced your name at all. They said that they've had the immense pleasure and benefited greatly from working with both Michelle and Tiffani. And she said that she hopes that she has the chance to learn from Alisha one day. The question is, how can you make sure that people like you don't burn out, because so many students, colleagues, and other professionals want to and need to learn from you? So how do you prevent burnout?
That's a good one.
I'll just say, for me, I don't know if I can have a burnout just yet, just because I'm so passionate about what I do, and recognizing that there are not a lot of people of color that are in the role that I am, being a dietitian. And so when I was going through, it would have been awesome to have a mentor that I could relate to, that I could talk to, converse with. So I think for me, at this stage, I don't know, I haven't been in 50 years like Michelle just yet. I got a few more to go. But right now, I think I'm excited about that, because again, it's that opportunity on my end to learn from them as they learn from me. And that's huge for me, because there's so much that people know in technology, and we can learn from one another. And I think that's so important. So I'm not there yet, but I just think because of I didn't have that, I would love to, I like to share that with others.
Well, I have a good support system, and I still have mentors. So that is very helpful. So when I think I'm ready to burn out or flame out, I have people that I can go to who offer me that support too. And Karen Probert is one of those people.
And I think I'm still excited like Tiffani is. So I like doing the work that I do. And I feel like because I'm have been given the opportunity to be in the space that I'm in, that I need to do all I can do while I'm here. But I also think self-care, I'm not that great at it. I work on it though. I'm a work in progress. So self-care, and I'm not trying to be funny, but have a really good therapist, because or another person that you can talk to that's neutral, that can you can talk to and get some feedback that might be outside of your circle, so to speak. And so you know, I think, you know, being passionate and excited about the work is definitely a benefit, but you know, in order to maintain at any level, you have to have some outlets. So, you know, self-care, and then, you know, having a neutral party that you can talk to that can just give you some clarity, you know, because you're going to need it at some point in life. And even if things aren't, you know, a mess right now, you know, you still, you also need somebody to talk about some of those wins with as well. And we don't oftentimes talk about our wins. We talk about things that didn't go right. And so, you know, you need to be able to celebrate all of those aspects, whether that's learning from something that didn't go right, or, you know, celebrating something that did.
You know, Alisha, I like the idea of the self-care. I always believe that you have to take time out for yourself. And I have a very good friend who always told me, you have to take your time out off the top. Because if you keep running and running, expecting to get it later on, it's not going to happen. You have to schedule your time out for yourself. I mean, even if it means looking at your calendar months ahead and saying, that week is going to be for me, and blocking that off, then that is good, because eventually when you get to that week, you will have that time. You've got to take your time off the top. Self-care is important, because if you don't take care of yourself, how can you take care of others?
And I learned that from my mentor, Michelle.
I really agree with that. I mean, as a student, I've already learned that you have to take your time off the top, schedule time for self-care. And also, you know, I have sometimes found that I've hesitated to reach out to other Black women or people of color who I've wanted to connect with or wanted mentorship from, because I assumed that they wouldn't have enough time, or that they're mentoring other people, you know, or that they don't want to talk to me. But really, that's never been the case. Anytime I've ever reached out to somebody for mentorship, they've been open to it. And people, you know, you have to assume that people are doing what they need to do to take care of themselves. And if you reach out to them for help, they'll probably be ready to mentor you and help. Do we have any other questions from people in the audience? Okay, well, I don't see any other questions coming in right now. I am going to just share my screen again for one last time. And I'd really like to thank all of you for attending this webinar. Like I said at the beginning, please follow APHN, the APHA Food and Nutrition section on Twitter, and follow ASPHN on Twitter, and use the hashtag APHA-FN Mentoring to share your thoughts on this webinar. And if you have any additional feedback or questions about the mentorship program from APHA, you can email us. And also we'll be sending out the information about both of the mentorship programs, which I discussed here today. So if there are no other questions, I just want to thank our panelists, Dr. Alisha Davis, Miss Michelle Futrell and Miss Tiffani Grant. It's been a real pleasure talking with you today and meeting all of you. And so I look forward to seeing what you all do in the rest of your career. And I look forward to, I'll be organizing the mentorship program for APHA. So I look forward to doing that as well. Any last comments from anybody on the panel?
It's been a real pleasure. I just enjoyed the discussion, and I look forward to hearing what you come up with, Sydney, as you move forward in your profession.
Thank you. Okay.
Thank you for the opportunity.
Thank you.
Thank you. All right, everyone, have a good day. Bye.
Thank you.